Before, we welcome you back. We're going to give an award from the Climate Stewards to Mr. Sarbanes. A delegation from the Climate Stewards visited him several years ago and came away with the idea we should present an award to Mr. Sarbanes.
I wish everybody would come away.
This is our opportunity to do that, so we're very happy. In order to present the award, I'm going to call on Callan Benson, one of our younger climate stewards, and I know Callan has a brief statement. I should mention, though, in addition, that Callan is the creator of an initiative called Parachutes for the Planet. And at the Climate March last year, Callan marched along with some help from others with a parachute that had over 1,600 signatures of young people asking for progress on climate change. Young people from Maryland, DC, and Virginia. And by young, I mean not yet eligible to vote. Right, Callan?
Yeah.
So this year, Callan is partnering with the Mother Earth Project, and the vision is for circular banners from all 50 states and as many foreign countries as possible displayed on the National Mall on Earth Day, April 22nd. So if there's any way you could help Callan, if you have a school that you're acquainted with or a grandchild who might help, wherever they might live, I know Callan would appreciate that. And if you don't get a chance to talk with her, you can Google or you can search on YouTube for Callan Benson, K-A-L-L-A-N, Benson, and you'll learn all about her project. Callan?
Thank you, Bill. I must state one correction, however. It's actually in Georgetown, not on the National Mall.
Oh, okay, very good.
Thank you all for coming. As Bill said, my name is Callan Benson. I'm 13 years old. Representative John Sarbanes has written, "Climate change is the challenge of our generation. In Congress, we must move from complacency to urgency. We must find the courage to act because it would be shameful to leave the potential catastrophic costs of inaction to our children and grandchildren." As a kid, those words deeply resonate with me. I've put a lot of effort into getting people to notice kids' concerns about the future, to convince our leaders to stop climate change. But I still see very little action and no sense of urgency. When a delegation from the Climate Stewards of Greater Annapolis visited his office to discuss climate change, Representative Sarbanes asked the question, have we passed the tipping point? For his leadership on climate change and willingness to ask the questions that many of us are scared to ask. We, the Climate Stewards of Greater Annapolis, are pleased to honor Representative John Sarbanes with this award of appreciation. Thank you.
Well, thank you, Callan. I appreciate it very much. Phil and the Climate Stewards, I want to thank you for hosting this evening. I want to thank Vinny for the forum we're about to launch and everybody else who's helping to sponsor this event this evening on Medicaid. But on the topic of health, there's a clear intersection between health and the climate, which is probably obvious to everybody in this room. I do just want to say that Callan is exactly the kind of person I had in mind when I decided 10, 11 years ago now to take up something called the No Child Left Inside Act, which was my piece of legislation to try to create a funding stream at the federal level to support grant programs and other outreach around instructional programming in our environment. And I'm pleased to report that last year, as part of the reauthorization of the Elementary and Secondary Education Act, we were able to get our legislation, No Child Left Inside, embedded in that as it crossed the finish line. And so the U.S. Department of Education now has some funding that can be available to support all kinds of grassroots efforts to connect young people with the outdoors and to make them, like Callan has clearly become, stewards of our environment, because they're the ones that are going to inherit this planet. They have to do their best, and with each passing day, they're demonstrating their strength to make this generation and generations above embrace all the things that can protect our environment, things like the Chesapeake Bay. I know people in this room and people in Annapolis and Anne Arundel County are oftentimes on the forefront of that fight. I want to thank you for it, and I very much appreciate the recognition that you've given me here tonight. And I don't know if you want to just kind of launch into opening remarks with respect to the topic this evening. I've had the privilege of being able to participate with Vinnie, Citizens Health Initiative, and all the various partners who've been working hard here in the state of Maryland, but also helping to drive and motivate the national efforts around affordable health care in many, many instances over the last few years. And we have to keep doing this. We have to keep gathering. We have to keep coming together. We have to keep raising our voices around affordable health care and reaching for the best possible way to deliver it in this country, which is an ongoing conversation. Right now, of course, we're still in that battle mode of trying to protect some of the gains we made over the last few years with the Affordable Care Act, which, as you know, is under attack. And this particular forum is going to give an opportunity for leaders in the community to talk about their perspective on what we can do to strengthen our healthcare system, but also it's a chance to hear from the famous quote-unquote real people in our world and in our communities who benefit from the Medicaid program and want to make sure that we keep it in place. We do have to acknowledge that we had some hard-fought victories in 2017, even though it was a very, very difficult year for the country. We were able to push back on efforts to eliminate the expansion of the Medicaid program, which Maryland and other states took advantage of, and that increased coverage for hundreds of thousands of Marylanders and millions of Americans across the country. So we're able to keep the expansion in place. And we were able to fight back on efforts that the Trump administration and Republicans in Congress undertook to actually go take apart the core Medicaid program. These are things that have been in place for decades. And if they've been successful with that, states like Maryland, all across the country, would have been essentially bankrupted by the failure of the federal government to step up and be a strong partner in the Medicaid program. So we were successful last year in pushing back on some of these attempts to really decimate the Medicaid program. And you deserve credit for that. It was the voices of Americans all across the country standing up saying, we're not going to let this happen, descending upon town halls, sending a very powerful message to those legislators that were sort of getting the notion that they could sort of rescind this promise that they made to the American people. And we were successful in being able to keep the core program in place. But the fight doesn't end, as you know. And right now we're seeing a couple of things underway. First off, the tax bill that was passed at the end of last year, which there's so many ways to characterize it. I look at it, I see $1.5 trillion being given away to the very wealthy and to corporations in this country at a time when middle class and working people are more deserving of support, and yet we wanted to add to the deficit to that tune just to give a tax break to those at the very top. In the course of doing that, as you know, the Republicans got rid of the individual mandate within the Affordable Care Act, which will have the effect, by all estimates, of reducing coverage over the next 10 years, eliminating it for about 12,000 people that otherwise would have benefited from healthcare coverage, including about 6 million people under the Medicaid program. So that represents a direct attack on the Medicaid program. Now, states like Maryland, I think, being pushed and urged by groups like the Citizens Health Initiative and Vinnie DeMarco's of the world and people like yourself, I think are going to try to step into the breach there and try to compensate from some of what happened at the federal level and make sure that we keep the healthcare system here in Maryland strong. So we're looking forward to proposals coming out of this year's General Assembly session that can help to do that. But your advocacy on those things is going to be extremely important. We also know that within the last month or so, again, following through on a broad agenda to roll back Americans' relationships with these important benefit programs, the administration and HHS has invited states to ask for the opportunity to put these strict work requirements in place for Medicaid program qualification, which all the studies show amount to just a punitive approach to Medicaid. It was not the way Medicaid was designed. It's not the way you get health care delivered to broad populations out there, but it reflects an attitude that comes from this administration. And so, you know, the state of Maryland certainly will be pushing back on that. We can anticipate, but we have to raise our voices against that kind of cynical approach to the way we provide benefits to people all across this country who are deserving of them. And the Medicaid program is no exception to that. So I can't thank you enough for being here. The fact that people, you know, 13 months, 14 months into this powerful movement that's happening across the country are still coming out in these numbers and showing that they are determined to have their voices heard is incredibly inspiring to me. It is not easy to go into Washington these days, I must tell you, to try to deal with someone in the White House who, whatever you think about his policies, and I'm no fan, but his style of governing is not disruptive, it's destructive. And it's very hard to get things accomplished in view of that. But Americans are up to the task. And I think our democratic institutions are strong enough to overcome the turmoil that's being visited upon us by this current administration. And certainly we can continue to strengthen our healthcare system in the face of that. So I want to thank you for being here. I want to thank you for your voices. I want to thank you, Vinnie, for this man never gives up any assignment. And he will stick with it for the duration, and he's been involved with issues in terms of public health from day one and continues to convene energy around it, and I want to salute him for that. And I know we have a number of other sponsoring organizations here tonight that you're going to listen to, and in particular we're going to hear some stories from those who are directly affected and directly benefit from the Medicaid program and from our efforts to try to strengthen healthcare in this country. I do want to acknowledge that Chuck Connor is here from Senator Van Hollen's office. Is Renee here? And I think Senator Cardin's representative may be joining us later. But obviously our delegation works very, very hard. All the Democrats in the delegation, the two senators, and the congressional members of our delegation to fight in a unified way to protect the healthcare system over the last year. And we're going to continue to do that. We're going to continue to do that, but we draw a tremendous amount of strength from people in the community that are standing behind us in this fight. So again, thank you for that. And I will turn it over to our MC, Vinnie DeMarco. Let's give him a hand.
Well, Congressman Sarbanes is one of my all-time heroes. So another big hand for Congressman Sarbanes. Maryland Citizens Health Initiative, and we're thrilled to be here with you. You have in your packet a document with a group of pictures, and these are pictures of all these events around the state. We had our very first one with Congressman Sarbanes and Congressman Cummings in May in Baltimore City, and we thought it was going to be a one-time event. We had Commissioner Lena Wen from Baltimore City, one-time event. We had people talking about the benefits of Medicaid, people like you there listening, and it was such a tremendous success. People loved it so much, hearing the stories, hearing from each other, that we took our show on the road. We went from there to Salisbury, to Silver Spring, to Prince George's County, Howard County, to Baltimore County, and now we're here in Annapolis. And we'll still have a couple more to go, but all across the state, we're getting the message out that Medicaid works. The Affordable Care Act is a success, and we are going to protect it. We are darn lucky that our two senators, and thanks Chuck for being here, tells Senator Van Hollen we love him, that our two senators and all but one of the members of the House from Maryland are fighting hard to protect the Affordable Care Act. Fighting with them. I'll talk a little bit more later about what we're doing here in Maryland, as the Congressman said, to protect the Affordable Care Act here in Maryland and to build on it. But one of the things that has made these events such a success all across the state is that at each of these events, we have highlighted the stories of people who benefited from Medicaid. We have heard all kinds of stories of people who could not afford to live in their house without the Medicaid program, who would have died without the Medicaid program, who had serious mental health issues and other kind of physical issues addressed because of the Medicaid program. And there's been also tremendous press coverage of some of these stories, and it has helped to teach Marylanders how important the Medicaid program is. We're going to hear a little bit from our sponsors in a few minutes, the great sponsors who have made this event work, but we're going to start with people who benefited from this program. And I'm proud to introduce first Thomas Shade, his mother J.P. Shade, and Caroline Fleschner to come on up, and they're going to tell their story of how Medicaid has helped them.
Welcome to I'm JP Shade, and I'm losing my voice. I have to actually have surgery on my larynx, but I currently do not have insurance because I make too much money, just a very little bit too much to be a Medicaid recipient, but yet my Affordable Care Act insurance went through the roof. My husband is disabled. He's had transplants and got cryptococcus, which caused him to go legally blind. He also has brittle bone disease. So he right now is on Medicare, and our son is Thomas, and he was born autistic, and we were told that he would never ever speak at age 2. Because of Medicaid, the autism waiver, he qualified for the autism waiver in 3rd grade. He started speaking and he hasn't stopped. Because of the autism waiver, which is for those under 21 that qualified, he got to go out into the community. He learned he no longer wears headphones. He can navigate things. He can cook some of his own meals. He will be living someday independently and working a job. He volunteers a lot right now, where he will be paying taxes and be giving back and a vital part of the community. It is very hard to fathom that we were told he would be institutionalized. And I had to go under my maiden name to go look at an ECI classroom, which is early childhood intervention, because he was told he had to go to Ruth Easton School, which was for more profound. And I was able to get him into the public schools ECI program. And since then he has gone, he's been in some plays, he plays the guitar, he does, like I said, his own grocery shopping. And because of Medicaid, We lost our insurance. My husband worked for the Defense Department as a private contractor with BAE for 31 years. And to have to go in COBRA was through the roof. It was more than our mortgage. Tom is qualified for Medicaid. He's also diagnosed with Crohn's disease and some other things. Without that, I have no idea where we would be. And he has written up something.
Okay, my name is Thomas. I have autism, ADHD, autism, Crohn's disease, and food allergies. When I was almost 2 years old, doctors told my mom that I would never be able to talk. But when I went to Mr. Cisco's ECI class at Benfield Elementary, I learned to talk and read words from A to Z. When I was in elementary school, I would come home from a tech from the hostess and would take me out in the community. Texts like Jessica, Cecile, and Mr. Pat will help me learn about things like how to be good, how to be safe around calls and loud noises, and how to talk to people and listen. The hostess will help me learn how to shopping in the grocery store and the dollar store. And in high school, I learned to type and to act and play. Great experience. My dad got sick and lost his job before high school. I was okay because I got a red and white card to help me when I went to the doctor. Those teachers, doctors, and techs like Caroline, I'll be able to get a job. I want to work at a lab because I'm good. I find where books and TVs go. I'll be a good member of the community. Thank you all, and thank you to Medicaid.
Do you want to add anything?
Hi, my name is Caroline. Through the Community Pathways waiver, I'm actually employed by Self-Directed Services as a home health aide, so I can provide things like community service learning and personal support for Common Shade, which is funded by Medicaid.
Thomas, we always call it his red and white card, and any of United Healthcare. He now has the red, white, and blue card, which is Medicare because of his father qualifying for Medicare. Thomas is now on Medicare also, but then the Medicaid picks up what the Medicare doesn't for his prescription drugs.
Thank you very much for that.
That's beautiful.
Yes.
Seth, can we take a picture? Wanda, can you take a picture here? Sorry. With Congressman, yeah.
Ready?
Miss your phone.
Well, my
What could be more moving? Thank you, Thomas, JP, and Caroline. Your story is really powerful. He ended by thanking Medicaid, and there are millions of Americans who thank the Medicaid program, and our whole society is much better off. And thank you very much for sharing with us. Is Emma Brindley here? Emma, another story about Medicaid and healthcare. Emma's come to a couple of these. Thank you very much.
So I have a little bit of a different story. I've actually personally never been a recipient of Medicaid, but my brother was. I first off would like to thank you. I appreciate the opportunity to speak in front of all of you. And the real message I'm trying to get across here, and I think Vinny is too, is that healthcare is a need and not really a privilege for many people. I believe our country and Maryland needs to make sure that those who qualify for Medicaid get adequate drug treatment and mental health services provided. About 15 months ago, I lost my brother to a heroin overdose. He struggled to find inpatient treatment and struggled to fund that. I recently did the math, it's about an average of $22,841 for 28 days in an inpatient facility if you're paying out of pocket, which just isn't reasonable for any patient trying to get help. Even though he had a full-time job, he was part of the working class for Maryland, he qualified for Medicaid. He was waiting up waiting for a bed to open up in one of the few Medicaid facilities in Maryland whenever he passed away. He was on a waiting list for about 2 weeks. There have been some laws put in place that have helped to allow addicts to get treatment in larger inpatient facilities, but Medicaid isn't covered in a lot of the facilities, and it's inadequate in sometimes helping to fund drug treatment, inpatient, and healthcare services as far as mental needs. There's so much stigma associated with drug treatment and that drug community and mental health treatment, when often the first introduction of opioids or any type of drug is through a doctor's office. But the main point I'm trying to get across here is that ACA is rescinded, Medicare is drastically cut, they won't be able to get help. No person, whether it's a drug addiction or a mental health problem, won't be able to get help because families simply can't afford it. I want more people to understand the impact of Medicaid, and so it's available for more people to get mental health and drug treatment. I think there's no better way of putting it. It's not really about the money. It's about the people behind the message. You know, Jordan, even though he lost his life to a drug addiction, lived a much healthier, better life because he was able to use some of the healthcare services with Medicaid. And if we don't continue to fund those services, people like Jordan will never have an opportunity to get help. So I appreciate your time, and thank you guys so much.
Thank you. Thanks for the courage to share your story very, very much. We're going to be opening it up to the public in a little bit to everybody in the room, but I want to now recognize the sponsors who made these programs possible all across the state and who are big supporters of all our healthcare expansion. First, I want to thank our financial sponsor, which is the Pew Charitable Trust, and we thank them very, very much for what they do for us here and what they do for healthcare all across the country. And Jeremy Crandall, you want to say a couple words for Pew?
Good evening, everybody. I just have to say, at a personal level, to Emma and Thomas, you guys are the real heroes, and your families for saying what you said. Just on a personal level, those stories are really powerful. And working in healthcare, mainly as a staffer, before my job at the Pew Dental Campaign, I worked for a state legislator here in Maryland, Delegate Heather Mazier, who worked on a lot of healthcare issues, but really the personal stories are what made me do what I do, so thank you very much. And I'm just going to say a couple of words of why we're supporting these events. So it's a sad story, but there's some good that came out of it. About 11 years ago, there was a young boy named Diamante Driver. Does everybody in the room know his name? A couple people. So Diamante Driver was a 12-year-old boy, lived in Prince George's County, about 12 miles from the Capitol building. He was on Medicaid at the time. Developed a tooth abscess problem with his tooth. His brother also had an issue as well. And his mom and a social worker called more than 20 dentists to try to find somebody who could take care of him. And for want of an $85 filling, unfortunately he passed away because of that oral health problem that was entirely treatable. One good thing that shining light that came out of that was, first of all, the state of Maryland did a lot of really awesome things to address oral health care access. In Congress, they did a lot of really good things as well. But that was what led to the Pew Dental Campaign, was because there's so much need out there when it comes to oral health access. And we don't often think of it. There's a health secretary in Massachusetts who refers to it as the ENTLs, like mental health and dental health. When you think about it, we sort of lop off the brain, everything above the neck, and don't really think about it when it comes to healthcare. And yet so much of our healthcare flows through the mouth. And so, thinking about it at the federal level, Congressman, it must feel like playing whack-a-mole because, we had to whack the attempts to get rid of the ACA, which included dental health coverage for kids. We've protected CHIP, thankfully, which included health coverage for kids. Exactly, very big deal, absolutely. But, federally qualified health centers, community health centers are still also at risk as well, and dental coverage is an issue there. And then speaking just quickly about Maryland, we've done a lot of really good things on oral health since Diamante passed away, but we still have about 250,000 kids on Medicaid that don't see a dentist each year. And only about 1/3 of dentists in the state even see a single Medicaid recipient each year. So healthcare for all, and there's advocates for children and youth and some other state groups are working to change that right now at the state level in Annapolis. We're trying to create a mid-level provider that'll expand access for people on Medicaid and create an adult dental benefit as well. So if you're interested in oral health as a part of Medicaid, and that's why we're all here, please come talk to me. I'd be happy to talk more about it. So thank you all for coming.
Thank you, Jeremy. We've had a lot of success in Maryland in expanding healthcare even before the Affordable Care Act, and none of it could have happened without the NAACP. We're thrilled that we have Wandra Ashley Williams with us, who's the Vice President of the Maryland branch of the NAACP in a national board meeting. And we're going to hear today from a friend of mine who was a young Democrat with me a couple years ago, who's Reverend Stephen Tillett, who's President of the Anne Arundel County chapter. Come on up.
Good evening.
Good evening.
So this is part of my torture for my 5-year-old this evening. She said, we're going to a meeting. She said, no, they're boring. Yes, welcome back. So it's always good to be at my brother Vinny's side. We've been on the right side of history and issues for about 40 years now. And I knew that we could count on him to get this done, the healthcare for all movement in Maryland. And I'm also grateful for Congressman Sarbanes, that I know a lot of times they say, well, you need to call your member. I said, I don't call my member. I know he's doing it right. So we're grateful. We're grateful for you too. I actually touched on healthcare a little bit in my book, and that there's a quote that I want to start with. It's been said you can tell a lot about a society by how it treats its powerless, its young, its elderly, and its infirm. What does the obsession to cut benefits for these vulnerable populations say about the soul and character of our country? Over 60% of the bankruptcies in America are the direct result of medical bills. Over 60%. And when we look at a 2015 report by the Census Bureau, there were 52.2 million, or 21.3% of the people in the U.S. participated in major means-tested government assistance programs each month. Participation rates were highest for Medicaid, 15.3%, and then the SNAP program, 13.4%. 39.2% of children in the country receive some kind of means-tested assistance. So 4 in 10 children in the country depend upon these programs to survive. And of course, we just heard about the need to expand that to dental. I just always wonder why people don't think dental care is important. I don't get that. So we are here to support your efforts to expand, basically kind of going against the tide right now. And I've heard, because we have a very robust political action committee with the Anne Arundel County branch, and that I heard some rumblings that there might be some folks who are not completely satisfied with some of the things that you're trying to pursue. And what I always tell them is never make the perfect the enemy of the good. Yeah. And I learned that lesson from Ted Kennedy, who during the Nixon administration was a proponent for a health care bill that would have been better than what the Clintons proposed in the 90s, better than what Obama finally got done in the 2000s. And because he couldn't get everything he wanted, he basically was like, no, I want it all or nothing. And he came to concede later on that was a bad idea. I should have taken what they gave me then, and then we could have kept moving, matriculating the ball down the field, so to speak. So don't let the perfect be the enemy of the good. We're not going to get everything all at once, but with each gain that we get, that's a stepping stone toward the next level of thing we have to achieve. So I'm grateful to be a partner with you, and for our national board member and Maryland State Conference First Vice President Wandra Ashley Williams' presence here, and let's get it done.
All right, thank you.
Oh, no, okay.
Get out.
We'd like to invite now MedCai, the State Medical Society, to join us. State Medical Society has always been amongst our key partners in getting everything done, and I'm thrilled that Dr. Pat Zapp is here to represent the Medical Society. I want to thank Teresa there for getting her here. But Dr. Zapp, you want to speak on behalf of the medical society?
I'd love to. Thanks for having me, Vinny. Do you mind if I sit down? It's been kind of a
Please,
long
please.
day. I'm so glad to be here. And I was invited to speak, and normally when I'm sitting in the audience, I write a lot of notes about, oh, don't forget to say this, don't forget to say that. And I didn't bring up my notes. You know why? There were only 2 words on the piece of paper. One was doctor, and the other was sister. So let me just speak from my heart. I'm going to open this up if that's okay. So I'm a family doc. I'm a primary care doctor, and I grew up on a farm and without insurance. We were quite poor, and just because you're poor doesn't mean you don't need health care, right?
Right.
You get into accidents, you get illnesses, stuff happens. You're a kid. So we had a doctor, one doctor in our tiny town, GP, a lovely man, Dr. Gales, God bless him. He would let us pay with eggs and vegetables. And sometimes it was a year of eggs and vegetables, but by golly, he took them with a smile, and he treated us with dignity and respect. And somebody like that in your life, they make a difference. So when I became a physician, I said, you know, I want to take care of the disadvantaged. So here in Annapolis, I do take care of the uninsured, the underinsured, and the newly insured. And I am continually struck by unfortunate souls who come to me at a time of crisis, or they go to the emergency room, and because they're common bread and butter conditions, hypertension, diabetes, have been left undiagnosed, untreated, they are presenting to healthcare for the first time, needing dialysis, an amputation, they've had a stroke, and they're not even 40 years old. That's pathetic. That is pathetic. Where I see patients, I am delighted to encounter what I like to call the newly insured. These are folks who have gone without insurance, and they have, up until now, experienced healthcare as a series of disconnected transactions with strangers, right? The emergency room, this specialist is the only one who knows how to treat this condition. And that's not a very satisfying type of experience. And in fact, it can even be harmful if you're negotiating those waters without somebody who knows you. So when folks get Medicaid and they see me, and for the first time they have a primary care doctor and they realize what that means. Oh, she'll take care of me when I'm sick, but when I'm well too. And she treats a lot of different things. And we actually talk to one another, and there's eye contact. And I think I trust her, and I think that I'll make decisions with her for what's best for me. That is gold, and that is a beautiful thing. And that is why I like to do primary care. And I promised I wouldn't talk too long, and I will tell you about the sister part. So, you know, I grew up in a farm, and all of us kids obviously didn't have insurance. And my older sister is a paragon of health. She's a very bright woman. And who chose a career in, you know, she's self-employed. She was an editor of nutritional types of writings, and she didn't have health insurance either. But she thought, and we all thought, by golly, you don't need it, Catherine. Took perfect care of herself, perfect diet, physically active, just did everything right. And she said, I'm going to live to 120, and we all believed it. She didn't make it till she was 60. So she didn't have insurance either. She lived in Michigan, which had Medicaid expansion, and still does, thank God. And like a lot of people who are very healthy, she experienced twinges and symptoms every now and then, but like a lot of people without insurance, chose to shrug them off. This will go away, that'll go away. And one day it didn't go away. And it got really bad, and she got very scared. And what do you think this woman who didn't have insurance and didn't have a primary care doctor did? She went to the ED, you're right. And there, she encountered a whole bunch of strangers who rushed around her, but there was this one angel who said, "Let me ask you a few questions. I think you qualify for Medicaid. Would you be interested in that?" And of course, my sister said, "Oh, I don't need insurance, but sure." And she did sign up for it. And unfortunately, that led into us 3 or 4 more weeks of crisis-driven, chaotic, catastrophic care, a diagnosis of 2 cancers, both advanced, sitting right next to each other, making it impossible to treat. And she had one doctor who was honest enough to say to her, in so many words, "It's not looking so good." And at that point, she realized she was going to die. And I picked her up and I took her back to Maryland. We were a mile away. And when she got here, I said, "You're in luck, sweetheart. We have hospice. I can get you Medicaid here as well. Not because you're going to need some big, fancy, expensive treatment, but in this time, this existential crisis that you are enduring, dealing with having to die quite soon, and you're worried about pain, and you're worried about how do I even understand what's happening to me? Do you really want to be worried about how am I going to pay for the social worker? How am I going to pay for the pastoral care coming to the house, the hospital bed I'm going to need, the morphine that I'm going to need?" She didn't have to worry about that. But I would say to you, yes, thank you, Medicaid. I wish that Medicaid expansion had happened a long time ago. Some very inexpensive tests that are routinely given on just about everybody, or certainly are offered to everyone with insurance, would have prevented her death. And I don't talk about the story very much, and it's been over a year since she died, and I probably couldn't have said all of this 6 months ago. So I appreciate your kindness. I can see it coming out of you, and your humanity and your generosity. And I am very heartened to see the turnout tonight, and I'm very appreciative of being here. And I thank you.
We're really hearing how important Medicaid is. We want to hear now from Healthcare Access Maryland. You know, the Affordable Care Act is a huge success in America and in Maryland. Despite the attacks, Congressman, despite everything President Trump and Republican leadership in Congress tried to do to undermine the Affordable Care Act, to scare people, during this past open enrollment, just about as many people enrolled as in the past open enrollments, even though they cut the time period in half. That's a testament to the people of Maryland who believe in the Affordable Care Act, and it's a testament to the Maryland Health Exchange, we're run by terrific people. Michelle Eberly, who's the director, is wonderful, and groups like Healthcare Access Maryland, who are the navigators who make it happen. And we're thrilled to have with us Joshua Morris, who's going to come and talk for a second about what Healthcare Access Maryland is. It can help you, your family, and friends get insurance. Joshua, yours.
Good evening, everybody. Thank you for having me here. My name is Joshua Morris. I'm the Outreach Supervisor and a Team Lead with Healthcare Access Maryland. Healthcare Access Maryland is a connector entity of Maryland Health Connection, which runs the state health insurance marketplace. In our connector program, we have navigators who are in-person assistance workers who can help the community, families, individuals enroll in health insurance, whether it's Medicaid or qualified health plans. Medicaid being medical assistance, qualified health plans being private health insurance with carriers such as Kaiser Permanente and Care First. I do want to share some metrics with you today. So pull these numbers. These are actually open enrollment numbers. And open enrollment was from November 1st to December 22nd this year with the extension. In Anne Arundel County, navigators were able to help 908 consumers enroll in Medicaid. In Anne Arundel County, navigators were able to help 699 consumers enroll in qualified health plans. Besides actual enrollments, there are other services that are offered, such as technical support with their applications, also plan shopping, determinations, any issues you might have that need to be escalated in case there's an error in the system. And for that other category, 2,035 consumers were helped during open enrollment period. Now, in total, extending past the Anne Arundel County area, 3,341 consumers were helped with Medicaid by navigators. 6,079 consumers were helped for qualified health plans, and 12,311 consumers were helped with those other services. Now, the best way someone can get help and enroll into health insurance or get more information is to go to marylandhealthconnection.gov. The best way to learn how to get inside assistance from a navigator who can help you navigate the process of going through the application from beginning to end to enroll is to go to healthcareaccessmaryland.org. If you go to that website, you can go to Enroll in Health Coverage, and you can see a list of enrollment sites. So just to share with you some locations that are close to you, there's Anne Arundel County Department of Health in Annapolis, Anne Arundel County Department of Social Services in Glen Burnie, Chase Brexton Health Services in Glen Burnie, Odenton Health Center Total Health Care in Odenton, and Center of Health in Annapolis. You can also call our HCAM call center at 410-500-4710 for those. Sure. Our HCAM call center, phone number 410-500-4710. And there you can get verify the locations and hours so that you're not just reaching in the dark, seeing if the navigator is there that day or arriving at the wrong time of the day. Now I do have two stories that I want to share. One's personal and involves a family member. I used to work with this family member in the healthcare field. Unfortunately, we went on a vacation, went on one of those nice tropical cruises where you expect to just have a good time, enjoy the weather, enjoy the cruise ship, the food, the endless ice cream that's on the ship. But unfortunately, once we got back, it seemed like maybe something had happened in maybe one of the oceans of one of the places that we visited. We're thinking it might have been a mosquito bite. It's kind of up in the air, which she's gone to the doctor before several times. And there isn't a clear distinction of what could have caused this. But now she's having seizures. She falls out without warning. She's unable to work, and her job, she actually was very high up in her job, making great money. She never had to worry about getting Medicaid. She had a private plan through the company she worked for. The health insurance was provided by the employer. But thanks to Medicaid, even though she's unable to work, and unfortunately still going through the process of getting disability, she has no income currently, she is able to have health insurance that pays for the medications she needs so that she doesn't have those seizures, at least not as often as she was having them. So it's been a big help to her, and it's been a big help to her family. So that's one success story. Another success story was a consumer that had contacted our deputy director, Joseph Poindexter. He's pretty much famous in Maryland. Everyone loves him. He's got a very deep voice, sounds like Barry White, and all the consumers love him. But he was in contact with the consumer's mother, who reached out to him because her daughter had recently broken her leg, and her daughters also had a daughter who collects survivor benefits because the father passed away recently. So not only was the mother dealing with a broken leg, but the daughter also didn't have her father in her life. So that's a big thing to adjust to. Unfortunately, their coverage of Medicaid had ended because it only lasts for about a year before it's time to renew, and they did not renew in time. But they were on top of things. They went into their account, updated their application, got through the process. But once they got to the verifications part, there's a little section that said that it was asking for security benefits for the mother. Now that's the issue that held them up because they had to apply their proof of income with the pay stubs, things like that. But they needed to reach out to us so that we could help them with that one verification. So I reached out to eligibility, which is another department within Healthcare Access Maryland. And they kind of function like a health department. So they have case managers, verification workers. And they were able to see that the mother didn't collect survivor benefits, it was just the daughter. So we were able to expedite the verification process for them so that their health insurance could get turned on sooner and the daughter and the mother could seek treatment without having to pay out of pocket. And I also just wanted to say thank you so much for having us here. And it was very inspiring hearing your stories. And we're always grateful and happy to help as many people as we can.
Thank you, Josh. Josh will be here to answer your specific questions afterwards, and he can direct you to where you and other friends and family who need help getting health care or keeping health care can go. So thank you very much, Josh. I saw earlier Carl Snowden. Is he still here? I want to tell Carl I'm saying he's great. Carl Snowden of the African American Caucus was here, great leader in Anne Arundel County. We also have other leaders here, 2 candidates for state senate. You want to stand up? Sarah Elred, Chrissy Holt. We're running for state senate. In a couple minutes, we're going to open it up to, and I see John O'Brien, the former head of Prince George Hospital. Thanks for being here. I want to thank all of you for being here. We're going to open it up to questions, but first I want to talk a little bit about what we're doing in Maryland to protect the Affordable Care Act, and I want to alert you to this couple things in this packet. You have in here a summary of a couple of the proposals that we are putting forward in the Maryland General Assembly. And one of them is called Basic Health Plan that would try to expand Medicaid to more Marylanders. 2 states are doing it, New York and Minnesota. We want to explore how to do that in Maryland. That's one. And the other one I want to talk about for a minute is our prescription drug affordability proposal. We hear all the time about people who can't afford their prescription drugs. And we hear all the time about premiums skyrocketing out of control. And one of the main reasons is because of prescription drug prices just going beyond control. Last year in 2017, Maryland became the first state in the country to prohibit price gouging by manufacturers of generic and off-patent drugs. A very exciting new law. Our wonderful Attorney General Brian Frosh is implementing it. Took effect October 1. We have a website, healthcareforall.com/hearmystory, where people can tell us, and you should spread the word about that website so people can tell their stories about prescription drug prices hurting them. But it's the other kind of drugs, the brand name drugs, that are really causing problems with our society and our health care. I'll give you an example of last week. We met a gentleman, Larry Zarzecki, who has Parkinson's disease, and he told us that only 32 Marylanders can afford the drug that can help him with Parkinson's disease because it's that expensive. We want to put in legislation to create something called a Drug Cost Commission, which would, for the first time, make all of these drugs affordable for Marylanders. So we're asking you all to contact your legislators. You have pretty important legislators in this area. Speaker Mike Bush, Senator John Astor, who sits on the Finance Committee, and urge them to support this legislation. And there's a description of it in here and how to call them. So I want to emphasize that to you all right now. Also, I'm going to ask my colleague Stephanie Clapper to come up and describe for you another document we have where we want your feedback. Stephanie?
Hi, everyone. In the very last page of the packet you were just looking at, we're collecting stories about Medicaid, the Children's Health Insurance Program, qualified health plans, any story about health coverage that you think is important for people to know about. I encourage you to write it down here. Also on your chairs is a survey, and it looks like this. It has the community catalyst logo on the top left, our logo on the top right. We're doing a survey to learn about our health advocates all over the state. If you fill out this survey and you fill out the very last page, then you can be entered to win a $20 gift card. Your responses and your name will be separated so that your responses are completely confidential. We will not use this back page if you enter for the gift card to contact you. However, if you put your name anywhere else, we will use that information to contact you. But this one, we will not. Finally, many of you signed in on your way in, but just in case, because a lot of the people came later, I'm going to pass around the clipboard if you'd like to sign up on our sign-in sheet and keep up to date with what we're doing at Maryland Healthcare for All. Please do put your contact information down. And I know that was a lot, so if you have any questions at the end, I'll be in the back. Feel free to ask me. Thank you.
Thank you, Stephanie. Thanks. Great work. Together. We want you to give us your information if you can, so we can get back to you on how you can contact your legislature. We're in session, Maryland General Assembly, until April 9th. We need your help. Reverend Tillett, you had that great quote from your book. You didn't see the name of the book or show it to folks. And Reverend Tillett has written a great book. Why don't you stand up and show everybody the book?
The book is entitled Stop Falling for the Okie Doke. I don't know if you all noticed there's a lot of okie doke going on today. Stop Falling for the Okie Doke, How the Lie of Race Continues to Undermine Our Country.
It's a great book. Thank you, Reverend. Before we open up the questions, I'm going to turn it back over to Congressman Sarbanes for some closing comments and observations.
Well, thanks, Benny. So, I'm your congressman, but way before that, I'm just a member of the community. I'm a fellow citizen. I'm somebody who gets amazed when I see the courage of my fellow citizens, and I want to thank you for the inspiration of those stories that we heard from Thomas and Emma, Dr. Zapp, and all the other stories that were relayed. I can tell you that back when we were trying to pass the Affordable Care Act, we had people coming from all over the country telling stories. It was the fuel that powered the Affordable Care Act. Those stories were mostly stories of real desperation and pain, because they were stories about what people couldn't access. A health event happens, your life collapses, and they wanted change. And after we passed the Affordable Care Act, this incredible thing happened. I would go to forums, I would be out in the community, I would be in a store, and people would come up and start telling me stories of hope, stories of how the coverage was there for them. I mean, it was amazing how it changed over. And I think part of what powered the pushback last year was people just didn't want to go back to those stories again. So what you heard tonight was why it matters that we do this basic stuff. I mean, Dr. Zapp really put a fine point on it. It's crazy that you would have a healthcare system that's really a sick care system that waits too long before you treat people, and then they show up in the last stages of opportunity for decent health care. What we tried to do with the Affordable Care Act was really flip it around and lean into prevention and lean into primary care and lean into screening and all of the things that expanded Medicaid offer and changes to the Medicare program and so forth. And we need to hold on to that, and we need to build on it. And that's what protecting Medicaid is all about. So I want to thank again the people who relayed their stories. I do want to salute Reverend Tillett and the NAACP and Wanda. Thank you for being here. Actually, I commend to all of you a piece in the Post that was written by Gerald Stansbury not too long ago about climate change. I mean, it's very on topic, but how climate change is hitting the African American community very hard. It's that intersection of health and climate change, and he really details why it matters. This is an article from January 19th, and it's got a lot of good information in it about that connection between our environment and our health, so I commend that to you. I've also brought this evening a few copies of a report that just was released by the Center for American Progress called 52 Harms in 52 Weeks, How the Trump Administration Hurt Communities of Color in 2017. And it goes through a whole litany of these impacts, among them climate, the environment, public land, as well as health care. And it shows how some of these impacts, when it comes to health, when it comes to the environment, fall disproportionately on communities of color throughout this country. We have to acknowledge that, and we have to help it motivate us to address those inequalities. And I want to thank Reverend Tillett for his leadership down here in Anne Arundel County. Actually, I commend his book to you, which he was nice enough to give me a free copy of the other night. I've already started to look at it and see some of those terrific quotes and the articulation of the case that needs to be made. So I want to thank him for that. And again, I want to thank you all for being here. It makes a tremendous difference to me personally. Like I said, sometimes it's hard getting up in the morning and trekking into Washington, which can be very dysfunctional. But this kind of thing empowers you to do it and try to make a difference. So let's keep sticking together on this stuff.
For the climate stewards. We are going to have a couple more of these left in Frederick and Southern Maryland, and then we're going to write a report about how Medicaid helps Marylanders, which we'll share with you. This has been very, very important, what we're doing tonight. We have two things left to do. We're going to get questions, and then before you leave, we have to get a picture of everybody behind our banner, so everybody in the world can see how great the Annapolis folks are at these Medicaid events. So right now, I'd like to open it up for questions and comments, and Congressman will stay for a little while. I don't think he can stay for the whole time of the questions, but we'd like to have your questions. We have your questions. Stand up, your name, and ask your question. Yes, ma'am?
Hi, my name is Kate Callahan. I'm with the Anne Arundel County Mental Health Agency, which is also part of the crisis response system in Anne Arundel County. And I'm sorry I don't see you. I'm very sorry about your brother. But because of the opioid crisis, we now have a plan in place that if you take any one of your loved ones or even yourself to any fire department in Anne Arundel County, they will get you help. And they'll get it for you right away. And also, I just wanted to mention that anyone with cancer, there's the Wellness House in Anne Arundel County, free social workers, free groups, free Reiki. And also, if you know someone who does not have insurance and needs help right away, Owensville Primary Care in South River will take anyone. And they also have a social worker there. And if you ever have any questions from anyone from 106 to 3, you can call the Anne Arundel County Mental Health Agency. We've been around quite a long time, and we have secret little resources that we can get you help that day if you need it. So that's all I wanted to say.
Well, thank you. John, do you have your
Yes, Congressman, words of hope and inspiration. Democrats in Congress don't seem to have much to do these days. Assuming things change this fall, is somebody working on the plan to undo what's been done?
Sure.
Particularly in healthcare.
Well, the Democrats have an agenda they're putting together called a better deal better wages, better jobs, better future. That's kind of the overarching framework. It's designed to say to the public, we can't give you the perfect, to Reverend Tillet's point, but we can do a lot better than what's been happening across the board. I do think that when it comes to healthcare, there's certain places where we're starting to get really even bipartisan commitment or movement. One is around the opioid and heroin addiction crisis across the country, because this is something that affects every single community, every single congressional district. I mean, there isn't a member of Congress who isn't walking around their district and hearing these personal stories coming out every single day. So I think there is a commitment there to try to address. Now, Democrats are typically putting more resources onto the policy proposal that we're making. But I think that if we're in a leadership position in the Congress, and that could be in either house, as long as we hold the gavel and the ability to decide what the hearings are on and what testimony gets brought to bear, we can take a leadership role with respect to responding to that epidemic, for one. Second thing is, there's a recognition, even among Republicans, that the drug industry is out of control, as Vinny pointed out, and that we've got to do something about this. The spiking of drug prices, the uneven way in which these medications are available across the country when they're needed. Alternatively, or conversely, evidence of pushing certain kinds of drugs on certain communities for profit. And there's an emerging body of evidence that suggests that the pharmaceutical industry, in terms of the way its lobbyists operated to be able to market to physicians and so forth, certain medications contributed to the acceleration of this opioid crisis across the country. So this is an industry that has to be reined in terms of conduct and in terms of pricing. Again, Republicans, I think, understand that they have to respond to this, but they're not taking the kind of leadership role the Democrats will be able to do on that issue if we can get the gavel back in places like the Health Subcommittee, which I serve on the Energy and Commerce Committee in Congress. And then finally, I'll say, getting back to this issue of kind of the intersection of the environment and health, that right now we have a Secretary of the Environmental Protection Agency who doesn't understand the basic mission of his agency. In fact, well, he does understand the mission, because he gets up every day absolutely determined to undo the mission and to fight the mission of that agency. This is a man who wants to turn his office into a secure, classified chamber so that he can, essentially, he says it so he can talk to the president privately, which he doesn't really have to do that often. We know that it's so he can have a conversation with industry representatives without anybody knowing what they're talking about. But he's already relaxed the rules that govern how toxic chemicals are treated out there in the stream of commerce. And there's a lot of chemicals we don't know a lot about. And he's rolling back very basic health protections. Because we don't hold the gavel of oversight, because we don't have subpoena power, we cannot investigate what's going on in agencies like that one and others. If we can get the gavel back, everything changes, and we can bring some real oversight on behalf of the American people with respect to what's happening in these places, and I think set the table for even more change in 2020. So those are some of the things we're doing, but again, it's under this basic rubric of a better deal. My particular contribution to that is going to be a better deal for our democracy in terms of reform that can empower people's voice again in what they think is a broken and rigged system. So ethics and accountability, campaign finance, reform, empowering the American voter at the ballot box. These are all things to reform, strengthen, and create a better deal for our democracy. so that the things we want to achieve, we actually can achieve because the system works again on behalf of everyday citizens. So you're going to be hearing about this as we move into the election cycle and down the home stretch. But look, I think most importantly is that so many people across the country are, in the words of Gandhi that I quoted the other day at the MLK dinner in Anne Arundel County, he essentially said, don't get angry, conserve your anger, and like we do with energy, transmute it into, or we do with heat, transmute that into energy, and that will become the power to move the world. Our vote this fall is our power to move the world. Every time we march, every time we knock on a door, every time we gather around issues that matter to us, we're putting energy back onto the electoral grid. Not the electric grid, the electoral grid.
Right.
And that energy is being drawn out in Virginia, drawn out in Alabama, drawn out in Wisconsin, and all across the country. This electoral energy grid will be on fire by the time we get to November, and then we'll see the change that we need in the country.
Recently, there have been a couple of cases that have made it to the courts with respect to gerrymandering that have resulted in the court saying, this is ridiculous, you all need to stop smoking crack and redraw these lines. If enough of that happens at the judicial level, is there any possibility that you all could task a nonpartisan, completely detached agency to use whatever computer software they need to draw the lines for contiguous districts? I know that's gonna mess with you because you've got one of the most gerrymandered districts in the country, but that there would be contiguous districts, and
Yes.
then the representatives, rather than choosing their voters, the voters get to choose you, and you all just have to stand and be held accountable.
The
Is that
answer,
possible?
in fact, the By the People agenda, which I'm sort of the architect of in the House right now on the Democratic side, which is what we're going to roll out for this kind of better deal for the democracy. In that last basket I mentioned, empowering the American voter, along with protecting access to the ballot box, automatic voter registration, strengthening the Voting Rights Act, etc. There's a bill in there called the Redistricting Reform Act of 2017, which would require every state in the country to put an independent commission, nonpartisan independent commission in place to draw these congressional districts for the reasons that you mentioned.
And also at the state level.
Well, once that's in place, it will govern the states in most instances as well in terms of how the state lines are drawn, because it's a problem there as well. So actually, if the Supreme Court, and it's increasingly looking like they might hand down a decision that would create standards around political gerrymandering, which they've never done before. Racial gerrymandering, they have a set of tests that they use, but political gerrymandering they've stayed away from. If they come up with a test, a set of standards, then I think, frankly, most states will be looking for the kind of solution we're offering with that bill I just mentioned. And then, as you say, let the chips fall where they may. I mean, you know, in Maryland, Democrats tend to have the advantage over the process in terms of how the lines are drawn. In most places where you see it is most egregious around the country, the Republicans have been controlling that process. But it doesn't matter. As you say, it's a legitimate point of grievance on the part of the public. And the reason it's happened is in the old days, there was politics in line drawing. But when you had to just use physical maps, it would never occur to you to take Glen Burnie and cut it into 3 different pieces. You wouldn't think about it. You'd be able to take Glen Burnie, so we'll put it in this district or that district. But when the computer came along, the computer doesn't know Glen Burnie. The computer just knows that there's all these little building blocks called precincts. And the computer gets the direction from the map drawers, create the best percentages you can. So the computer goes in there and starts putting them all together, and next thing you know, you have a very strange looking district. So this is why the problem has gotten so much worse, and I think offends people's sensibilities when it comes to the political voice that they think they ought to have. So that's definitely part of the package that we are putting out there, and that in combination with what the courts are doing right now could create a significant change soon.
Hi, I'm Chrissy Hull. Thank you for your service all these years. I brought with me my December bill from Blue Cross Blue Shield for $85,000 for my son's medication. And as you know, I'm a long-term advocate for the hemophilia community. And we aren't going to support your pharmacy bill. We can't endorse that. And we can't endorse that because we believe that it's going to actually help the insurers and the pharmacy benefit managers. So my son's, the unit price 22 years ago when he started his hemophilia medication was $1.18 a dose, and it's now $1.37 a dose. So it's only gone up 20 cents in 20 years. So what we would submit is that the insurance companies and the pharmacy benefit managers are the ones that will benefit from this, and not the consumers and the patients. And further, because we are one of the most expensive diseases, we don't believe that a legislative board here in the state, should be deciding what happens on the pharmaceutical side when we only have 2 manufacturers that actually make our product. So it is a concern for us. It's a concern that we're not having the insurance conversation. This was a great meeting today to talk about Medicaid and how it is helping people, and that everybody, who meets a certain income is worthy of it. Everybody who's a certain age is worthy of it, but there's this middle gap of us that we even refer to, can't afford COBRA, can't afford our insurance premiums. It's sort of weird to be talking about segments of our community that deserve healthcare as a human right, but the rest of us don't. And so, as you know, I'm a huge advocate of new and improved Medicare for all, and we're not talking about that. We keep talking around that, and that's a huge concern and continues to be a concern. If we had a single payer process here in the state of Maryland, we would have the pharmaceutical transparency that we need. All the doctors. So we can't play this game anymore. My son's going to roll off the Affordable Care Act in 4 years. I'm not going to submit my son to the same 26 years that I've been fighting for his health care. He was born uninsurable in the state of Virginia. I had to move back to the state of Maryland so that I could get him health care. And here we are, an $85,000 bill from Blue Cross Blue Shield. And we all know, right, that we write big checks for Medicare and Medicaid to the insurance companies. As a matter of fact, we wrote $213 billion, which represented 60% of the revenue for the top 5 insurance companies in our country. We are driving their revenue. We have plenty of money to cover the health care in this country. So we're not going to support that pharmacy bill, and we don't think that it's going to help the patient. And the patient wants, let's get rid of the insurance companies, get rid of the middleman, and let us have health care.
So, a couple things. I mean, respectfully, I think that this would be a step forward to have this kind of oversight and regulation in Maryland with respect to the prescription drug industry that's proposed in this bill. So I think it ought to certainly get consideration, and I think you ought to provide your perspective on it, as should others, because now is the time. The General Assembly is taking a look at this. And I also want to commend the legislation from last year that gave the Attorney General the ability to start to get behind the industry's kind of cloak. That's critical. One of the things that we're emphasizing at the federal level is this issue of transparency. Now, you correctly observed that the pharmacy benefit managers, which have become these kind of giant mystery middlemen organizations, it's like a black box, and they determine all of the pricing that happens. They use the excuse, which they started out, I think, actually doing in a legitimate way, which was to sort of act as a negotiator between the industry and the ultimate delivery of these drugs. But somewhere along the way, they became these behemoths, and they just wanted to start generating significant profit for the bottom line. And we really have an incredibly difficult time getting in there and getting the transparency to understand what's happening with them. Now, I frankly start from a relatively radical place in terms of the pharmaceutical industry, which is, I think, that in many respects, what they offer is so dependent upon by the public that you ought to bring a kind of public utility lens to the way that industry operates. Now, that puts a shudder through the industry when you talk that way, but I'm not sure anything short of that is going to get us the transparency and the kind of regulation over the way they behave that we need. So I think there's very legitimate grievances in terms of how the Rubik's Cube, or it's not the Rubik's Cube, the Rube Goldberg contraption of our healthcare system allows unscrupulous actors with a lot of power to get in there and, again, maximize their own profits sometimes in ways that don't really align with the public good, and that's where the public needs to step up and push back. I'll close with this observation. That's one of the reasons I'm so committed to this idea of public financing of campaigns, because until we liberate members of Congress and policymakers all across America from the deep dependence they have for campaign money on special interests, insiders, and the big money crowd, we will continue to do their bidding. If we can break free of that, if we can have real citizen-owned elections where it's the public that holds the power, then they can send their lobbyists in their offices, they can make their case, but we won't be beholden to them to survive, and that will completely flip the script and the dynamic. So public financing, look, it's easy to connect the dots. Look at legislation the American Chemical Industry wants, and look at where their campaign cash goes. Look at what the pharmaceutical industry wants, and look at the lobbyists and the campaign money that flows on Capitol Hill. Look at what the oil and gas industry wants to see, and you can draw a direct line to the loopholes that they get to the tune of $5 billion every year from the U.S. Congress because of the campaign money that they're putting in. We eliminate that, we break that dependence, and we can serve the people again instead of serving the special interests.
Aaron Axon, Mike Christie, and Sarah here. I'm a candidate for delegate here in District 38.
Oh, and thanks for
I'm sorry I'm a late arrival on this. I just wanted to continue the conversation for a second on this campaign finance reform because you spoke to a need for that I think all of us understand. That is a stakeholder game. The stakeholders are actually in Congress right now, and I would ask you to speak to how we wrench ourselves out of this when the stakeholders are the ones that are benefiting.
So I have a proposal. It's called the By the People, Government by the People Act, which would create a small donor matching system to fund congressional campaigns. So you have to be able to show, in my case, my colleagues, that this is a system that could actually work for them. And we ran a model, and we put their fundraising numbers through it. And I was able to show 80% of my colleagues that if they gave up PAC money, if they reached out to small donors and earned a 6-to-1 match of public financing behind that, 80% of them would do as well or better in that system than they're doing now under the current system, but they would not be dependent on big money. The average member of Congress now is receiving every 2 years $734,000 from political action committees. There are 100 members of Congress who receive over $1 million every 2 years from political action committees. I did the crazy thing a few years ago, saying, let me see if I can not take any PAC money. And so you're looking at the longest serving PAC-free member of Congress. I start every cycle $750,000 in the hole compared to my colleague. Now, am I a saint? No, because I get a lot of money from big donors, individual donors who can contribute $1,000 or $2,000. So I'm not a saint. I'm just trying to migrate from the fossil fuel of campaign funding, which is, the PAC money. I want to get to the renewable energy of campaign financing, which is small donors. And so I'm kind of moving through the natural gas bridge. But if you create a system that rewards members of Congress for finding everyday citizens and talking to them and asking them to reach into their pocket with a $25 donation that will then be amplified 6 times, we'll go there in a minute. I can tell you that from talking to my colleagues, because we don't like living in a world where we have to go spend time with lobbyists on K Street, money people, to fund the campaigns that are supposed to be about reaching to the broad public. I want to combine those things. Go to the public to power my campaign financially, and those are also the people that will knock on the doors and make the phone calls for me. That's how the democracy should work. And here's the good news. We don't have it at the federal level, but we have it in Montgomery County, Maryland. It's coming in Howard County, Maryland. Seattle's got a voucher program. New York City's got this. Arizona, Connecticut. Berkeley just put in. All across the country, people are saying, we're going to take these systems back. We're going to create citizen-owned elections, and then you will answer to us instead of to the inside crowd. So thank you for your support on that.
Thank you, Mr. Sarbanes, for being here, and thanks for having this meeting. I just have a couple of points that I wanted to make, not nearly as significant as some of the stories we've heard tonight. But our family, this is my cousin Fran, our family, for the first time in my life, has been touched by the need to get public health insurance. Fran's husband was a Baltimore City police officer.
35 years.
45 years.
35
years. And he was Rookie of the Year in 1966.
Yeah.
And he sadly was diagnosed with having diabetes, and over the years he had become blind and disabled, and eventually, just in the last couple years, has needed assisted living and then long-term care. And the cost of long-term care that he needed is $12,000 a month at the Genesis facility. So we've been going through the process together. I've been helping her with the paperwork, and we've been working with an attorney here in Annapolis to try and go through the process of qualifying him for medical assistance without impoverishing Fran, right? And I have to say, first of all, we're very grateful and thankful that Maryland is one of the few states left that does not require the impoverishment of a spouse in order to qualify someone for medical assistance. And that's been very helpful in the process. I would like to say, though, from the experience, it's been 7 months and we're still not approved yet. And the whole process is very, very complicated. It's not automated. It's paper-based. The poor caseworker has 70 cases they're working on, and they could use some resources. So just from my experience, and I've worked 22 years in healthcare information technology and systems integration, and I know that there's document imaging systems that could help in this case. There's databases that could help in this case, and it doesn't seem like there's any IT that's been applied to this process effectively anyway. So I think that we could do a lot to expedite applications and to help support people like Fran, who have been good, hard working public servants all their lives, have saved a modest nest egg, and to be able to get through this process, and also for the facilities that care for people who require a lot of care, they need resources to take care of the patients, and if they have to wait months and months and months, I mean, the bill's up to like, $80,000 now, that they're waiting to get paid back to last July. So, so I have to just say that's one area where that could use some help. The second point that I wanted to make has to do with, I have two other members of my family who have needed to have public assistance. One in California now, but one is here in Maryland. He's self-employed, and the other one has a mental health issue. And both face unpredictable incomes. The one with the mental health issue because he can't keep a job, and the other one because his work is sporadic, event-based type work. He's a sound engineer. And so when he's doesn't have a lot of work to do, he has to go on Medicaid during the winter, and in the summer when there's festivals and he can do work and he gets work, then he's not eligible for the Medicaid. So this back and forth is also very complicated. I'm trying to help him do the right thing and not get into trouble, and not have to pay the individual mandate, which I guess is not a problem anymore, but he still needs coverage, so I made sure and I got him to sign up. But just managing the complexity of, is he Medicaid, is he not Medicaid, and whatever, that's a challenge for me, helping him to try and do the right thing. And just to kind of add to that story, I'm 59 and I just recently lost my job of 22 years. And I'm not old enough for Medicare. And so I went out on the exchange to look for what premiums would be for me and my husband. And with a $6,000 deductible, $22,000 a year in health insurance, and I'm not working now. It would be really nice if I could buy into Medicare.
Yes.
With some of my 401k money, but I am not eligible to do that because you have to be 65. My husband's not 65 either. So I've got several years that I've got to look at maybe $30,000 a year. I don't know how much money you have to have in the bank to consider being self-insured, but I never would have thought of that as an individual,
Right.
So the whole thing of coupling employment to insurance and not having a public option that people of all ages and all incomes can consider makes it really difficult, to do.
Well, let me just respond. First of all, thanks for address there. I think that if Democrats had won this last time, we'd be having a very robust debate about how to address premiums, how to address coverage, where the broken parts of the system are right now, whether a public option as a transitional thing or an immediate leap, as I know some people here would prefer to see, to a Medicare for all kind of system makes sense, and how you can, what's involved in doing that. There'd be a robust discussion happening about that. It's hard to have that discussion. We don't, again, have the gavel and the ability to bring the testimony and have the hearings around it. That's what I think we can begin to get back to if we can change things in the fall and then carry that momentum into 2020. On your first point, I do just want to say that we have a president who thinks, and I was going to fill in the blank. I don't know what he thinks. I don't know what his ideology is. I do know that there's a Republican agenda to discredit government's ability to serve the people, to starve government of the resources it needs to deliver a high quality product and service to people. And they're making real progress with that agenda. I mean, what they do very cleverly and diabolically is they cut resources to agencies who have to deliver a service, making it impossible for that service to be delivered well. And then they turn around and say, see, those agencies can't do it, government doesn't work.
That's why they're raising the Park Service prices.
Exactly, and they fulfill this prophecy that they've delivered, that government can't function. And the public and the citizenry has to be really alert to that, because it's easy to fall into that trap. Because you try to make a call, you can't get through, you get frustrated, it takes 7 months for something that should take 6 weeks, for example, and you say, government doesn't work. But you gotta look behind that and realize somebody's trying to make it not work. They don't want you to be served well. So we have to counter that narrative. And you know, there's a lot of, the federal employees, for starters, have become a punching bag and a scapegoat over the last few years at the hands of the Republicans. So many of those people are such decent public servants, career servants, want to do the right thing. The IRS is going to have to implement this crazy tax bill that they just put in place. It's going to create the questions people are going to have about that, the uncertainty there's going to be about that tax bill. You would need to triple, quadruple, multiply by 10 times the folks that are going to work the phones to receive the questions that are coming in. The IRS, the number of people working there has been reduced by 26,000 people in the last few years, and the Republicans want to cut it even further, right at the point where the public is going to need as much help as they possibly can get from an agency like that. So this is why it matters. This is why elections matter. This is why making government function properly matters. So thank you for your story.
But you all did have
Nominating
the
the right
gavel
presidential
in both
candidate,
houses
too.
and the White House in 2009 and 10.
Yes. We did, and we made some progress on healthcare and some other things, on the stimulus bill and trying to prop up an economy that was going down the tube. We could have done more.
Yeah.
By the way, when I talk about the influence that big money has, I'm not just talking about the influence on Republicans. It affects everybody. Everybody gets dependent on it. So when you want to get something done and you have the gavel, if the money is still calling the shots, you don't actually deliver what the people want. You can't get, the pharmaceutical industry made a deal because of the power they had. Even when we had the gavel, and we don't have the ability to negotiate through the Medicare program with the pharmaceutical industry because of the power they have, because of the money they have. So this isn't that particular issue is not about Republicans and Democrats. That's just about Americans and their government. But
Why can't we control what they do with the prices? Why can't we put our thumb on them?
Well, let me just address first something that's come up a bunch about premiums. There's a chart I saw recently showing that after the Affordable Care Act was enacted, and by the way, we did expand healthcare to 20 million Americans, 400,000 Marylanders, saved many, many lives. The premiums were going up at a rate higher than they should have been, maybe 15, 20%, until Donald Trump became president. In the year 2017, premiums on the Affordable Care Act went up by 50%, in large part because of Trump administration's attacks on the Affordable Care Act, which scared insurance companies and caused a lot of the premiums to go up. We are trying in Maryland to do what we can to protect that, but we need to have, as Congressman says, Congress moving forward, which we hope will happen soon. So I want to, and we need to deal with prescription drug prices. And as Congress said, our proposal will do exactly that. Under our proposal, the Drug Cost Commission will be able to say, in Maryland, you can't charge the $80,000. You can only charge a reasonable amount. So I think our proposal will help a lot in that direction. We have one more question, and we'll let the Congressman go.
I just wanted to share my experience with the Maryland Exchange and how they put me in debt for $16,000. So back 2015, I had been, I did the ACA that previous year, so I was supposed to re-enroll. So I called and, do the application. And because we were having some issues with financial issues, they said, you qualify for Medicaid. And I was like, no, we don't really want Medicaid because, our premiums were fine the previous year. And they said, no, well, you don't have a choice. I'm like, okay, well, I had paid my premium for December.
and my son had deviated septum, so he had surgery December 10th. So by the end of the month, I get a call from the doctor saying, oh, well, you weren't insured. And I'm like, what? You know, I paid my insurance, my insurance should be active. So, I get sad, but anyway, so I call Care First. They're like, nope, your policy was ended end of November. So then I call the exchange and they're like, well, you, after all, don't qualify for Medicaid. Oh, well. So I've spent 2 years now trying to get that fixed. And I still owe $60,000. And yesterday, last conversation I had, and I don't know which office is in Pasadena, but I spent a lot of time over there. And Anthony from Maryland Health Benefits Exchange said that, oh, well, we can make it so that your December, if you pay your premium, we'll have that, retroactive, whatever. But we can't guarantee now that Care First will go ahead and honor that. So now I sit here, I'm in debt for $16,000. My credit is bad because I don't have $16,000 to pay for it. And nobody can help me.
Well,
Now, if I had Medicare for all, I guess
the
that would
exchange
be.
can help you. We can talk to Josh a little bit about that and hopefully.
But it was like, it was no fault of my own. I did whatever I was supposed to do. And now, it's like, oh, well, out of
And that
luck.
shouldn't have happened, and I hope that they fix it. All I can say to you is that there are, as your comment, there are
No, and
hundreds
this
of
isn't the only
thousands.
one. I mean, I've had numerous issues.
There are hundreds of thousands of Marylanders whose lives are better off, millions of Americans under the Affordable Care Act, and we're gonna do everything we can to protect it. Thank you very much for being here. Let's have a big hand for the Congressman and everybody with a story. Now what we'd like to do is gather around the Congressman for a picture for our website. Yeah. Can we move the table too? Can everybody join us back here? We're gonna all stand behind the lamp. Audrey, you gotta be in. Great. Take this picture. Come on, John, you gotta be in here. Come on, everybody, gather around. Steve, you gotta be in here. Come on, Jerry. We want more of the people in here. Come on. Gather around. Make sure Stephanie can see you here. Get the picture. Okay, everybody smile.
Now, where are we looking?
Look
Center first.
Over here. I'm taking a panoramic, so everyone's gonna be in it. So you all look beautiful. You guys look so great like this. We did that
on our website.
All right. Bless you.
Thank you very much.
Nice to meet you.